Hi, I'm John Gunselman. I'm a urologist with Northwest Urology at our Slabtown location in historic Northwest Portland. What got me so interested in urology is that it treats many quality of life issues. Urologists treat kidney stones, which can be painful. We treat cancers, many of the most common types of cancers, which can be life-threatening. And we treat many different types of urinary issues, which can be frustrating. They can cause sometimes isolation or embarrassment. It's a special privilege getting to be a urologist because we get to see the results that we're affecting into patients' care. I had an atypical pathway to becoming a doctor. I initially was a mechanical engineer before deciding that I wanted to treat people. I eventually went on to Chicago College of Osteopathic Medicine and did my residency training at Albert Einstein Medical Center in Philadelphia, and ultimately did a fellowship in urologic oncology at Yale New Haven Hospital. Each patient's a little different, and I like to approach them differently. Some patients just need education, behavioral management. Other patients might require medicines, minor or even major surgeries. Urologists are fortunate to have a large tool chest that we can offer patients a number of treatments. One of my specialties is in robotic surgery, which is one of the standard of care for many cancer treatments as well as reconstructive urology procedures. Meeting with the urologist can sometimes be an intimidating process. A lot of urologic issues are sensitive and some patients don't feel comfortable with that. So I try to keep things as simple and comfortable as possible. I like patients to have an understanding of what's going on so that they can feel engaged in the process of decision making, and ultimately we can come up with a plan that works for them. The highlights of my career usually come in the form of day-to-day patient wins. One of the most memorable things that I can recall is a patient I had early in my career. She had a very aggressive cancer, and she got this diagnosis just months before learning that her daughter was pregnant with her first grandchild. So you can imagine the emotional burden she was going through. We talked about a plan which involved surgery, and frankly, with her, I was admitting that this might not be the only treatment, and even still I wasn't sure about the prognosis, but we got her through surgery successfully. She did great. She had an excellent recovery, and here 8 years later I'm still seeing her annually. She's doing well, cancer-free, she's involved in her granddaughter's life, and it's just a real great success story in my mind. I like Portland because it's a great mix between outdoor opportunities and a casual cosmopolitan lifestyle. It's been a great place to raise a family, and downtown Portland has a great food scene, arts, music, and lots of small retail, so it's been a really great place to live. In my free time, I like to spend as much time as possible with my wife and 3 kids, exploring Portland and this beautiful state of Oregon. When I'm not doing that, you might catch me out for a run or going for a hike, or potentially trying to be the landscaper that I will frankly never be.